Recently, the Armenian American Health Professionals Organization, AAHPO, organized a medical workshop titled Cancer Update, with emphasis on breast and prostate. Virtually every month, doctors of AAHPO meet the members of our community as part of the ongoing medical workshop. These workshops are designed to educate and share information with our compatriots about various illnesses and their treatment and prevention. This particular workshop was hosted by the Armenian Church of the Holy Martyrs. AAHPO's president, ophthalmologist Dr. Larry Najarian, in his welcoming remarks spoke about AAHPO's mission and the importance of knowing how to prevent illness and how to fight against them. The workshop's panel participants were Teranik Terjanian, MD, Hematology and Oncology, Dr. Deborah Furman, MD, Hematology and Oncology, Kanadi Kachadurian Meyer, PhD, RDN, and Karine Shinor-Hokyan, registered nurse, MSN master's degree in nursing. Dr. Deborah Furman spoke about the screening for breast and prostate cancers and presented the latest statistics about the spread of this disease among men and women. She discussed the benefits and drawbacks of prostate and the latest medical guidelines regarding the treatment. She also discussed the risk factors, including family history of prostate cancer and high-risk ethnic population. Switching to the topic of breast cancer, Dr. Deborah Furman stressed the importance of early mammography screening that could potentially save lives. She also spoke about overdiagnosis and unnecessary treatment in younger women.
I'm a physician in hematology oncology, and my passion lies in all things medicine. And my goal is to help the Armenian community remain healthy, educated about common medical problems, and also help those in Armenia and improve the medical care in Armenia. AAHPO is beneficial for the Armenian community because we're trying to educate our parishioners and our community about the general health problems, and particularly this program today talks about breast and prostate cancer and screening so that we can identify cancers in patients early so that it could be cured.
Karine Shinor-Hokyan shared with the audience a personal story of her husband's grandmother, who after living a long and fruitful life chose to end her life with dignity. She then went on to speak about the end-of-life care, emphasizing the fundamental rights of the petitions to make the choices suitable for them. She also discussed the avenues the family of the terminally ill person can navigate difficult emotional decisions involved at the end-of-life care for their relative.
Now, my background is nursing, and though there are many ways to treat, sometimes in the same respect, we also need to focus on when the treatments become too much and other options of care that may not necessarily reflect on the aggressiveness of treatment, but more of the comfort and the compassion and the dignity involved.
In his presentation, Dr. Teranik Terjanian discussed the management of breast and prostate cancers. In particular, he spoke about the ongoing discussion of performing invasive surgery versus leaving cancer untreated in women with breast cancer. He also discussed numerous treatment options for women after breast cancer surgery, including radiation, hormonal treatment, and chemotherapy.
AAHPO's goal is essentially to serve the community in different ways, either by raising money, whether for Hayastan or people who need efforts, different types of medical advice, or even to direct them to medical facilities in the U.S. But essentially, the goal is to serve the Armenian community in different ways.
Dr. Kanadi Kachadurian Meyer spoke about the importance of diet for cancer treatment. She identified the Mediterranean diet as one of the better diets suitable for cancer patients. She recommended protein-rich foods, including nuts and fish, as well as exercise as part of a healthy diet lifestyle. Other recommendations included olive oil and fruits, particularly citruses, to keep a healthy metabolism.
AAHPO is a very important organization because it's a very dedicated organization to the Armenian community. We aim at educating the Armenian public about various health situations like we have one today.
Following this informative presentation, an active Q&A took place during which the audience members had an opportunity to ask many health-related important questions.
This is such a blessing for our community to come together and to learn something which is very important, because we keep saying it's not only important to take care of our bodies but also our spirits, our souls, but sometimes we even forget about our bodies, our health issues, our physical bodies, and it is very important to take care, likewise as we do as a true Christian believers.
With many events, humanitarian programs, and workshops planned for the future of AAHPO continues its important mission to serve the health needs of our community here in the United States and in the motherland of Armenia.